Are you trying to have a baby? Does sperm health matter? Does male fertility matter? Did you know that infertility affects 1 in every 6 couples who are trying to conceive today? Half of the cases of infertility, the male is the major factor. This means if a couple can't conceive, there is a 50% chance the male is infertile. Today, I'm going to discuss sperm health and male fertility. As this series progresses, we will learn how to increase sperm health and male fertility. Help Me Get Pregnant Naturally is a series of information. Each series will have a plan on how to increase your chances of getting pregnant naturally. I'm going to provide you with advice and tips on how my girlfriend and I had our first newborn baby at the age of 45. Not only did my girlfriend get pregnant and defy all odds, but we also produced a perfectly healthy baby girl. She scored a 9 out of 10 because the hospital does not give out a 10 out of 10. I will give you all the information we used to enter this whole new world of parenthood. Hi, I'm Denny Moser, and welcome to Dad's Den. A little history about sperm health and male fertility. At birth, a boy is born with undeveloped sperm cells. These precursors eventually become mature sperm after they reach puberty. Boys start producing spermatozoa, or sperm for short, at the onset of puberty. Boys usually start puberty when they're about 10 or 12 years old, though some start a little sooner and others a little later. Spermatogenesis, the origin and development of the sperm cells within the male reproductive organs, the testicles or testes. The testes are composed of numerous thin, tightly coiled tubules known as seminiferous tubules. The sperm cells are produced within the walls of the tubules. Basically, the entirety of a man's sperm production stems from the original undeveloped sperm. That is, these immature sperm cells make exact copies of themselves. These originals are then saved for future use, while the duplicates transform themselves into 4 mature sperm each. However, if all man's original undeveloped sperm cells were damaged or killed, he would be sterile because his body no longer has the resources necessary to produce more sperm. Yes, a newborn boy can be infertile from birth. Blockages, birth defects, or physical damage. In some cases, boys are born with blockages in parts of their testicles or other abnormalities that prevent sperm from getting into the semen. Physical trauma to the testicles, prostate, and urethra can also result in fertility problems. Men who don't have sperm in their semen have a condition called azoospermia. It happens to about 1% of all men and 15% of infertile men. There aren't really any symptoms that you'd notice, but if you've been trying to get your partner pregnant without success, this condition could be the cause. Male infertility is when a man has a poor chance of making his female partner pregnant. It usually depends on the quality of his sperm cells. Sometimes infertility is linked to sexual function, and other times it could be linked to semen quality.
Definition: erectile dysfunction is when a man is unable to develop or maintain an erection, known as impotence. Libido describes a person's desire to have sex, known as sex drive. Sperm count is the number or concentration of sperm cells in a given amount of semen. This is an important aspect of semen quality. Sperm motility is the measurement as the percentage of moving sperm cells in a sample of semen. An essential function of healthy sperm cells is their ability to swim. Testosterone levels, The male sex hormone may be responsible for infertility in some men if they have low levels of testosterone.
Infertility can have multiple causes and may depend on genetics, general health, fitness, diseases, and dietary contaminants. Male fertility does change with age. While the change in fertility is more drastic in women, men have a biological clocks too. A research study conducted in Soraka University in Israel looked at fertile males and compared the quantity and quality of semen to the men's ages. The study looked at everything a semen analysis would, including how often they had sex. This is important to consider because sexual abstinence can lower semen
quality.
Frequent sex creates healthier sperm.
Sperm motility. 25 years old and younger, the sperm motility is at its best. 55 years old and older, the sperm motility is at its lowest. When comparing 30 to 35 years old to men 55 years and older, the sperm motility decreases by 54%. Sexual abstinence was tracked in this study and it cannot be blamed. 30 to 35 years old, semen quality peaked. 35 years old and older, semen quality is at its lowest. Male semen average, 45 to 47.8 years old. Male semen equals an average of 2.80 milliliters. At 56.6 years old, male semen equals an average of 1.95 milliliters. This shows us a big drop of semen at the age of 56.6 years old.
Besides low quality semen, age also affects the genetic quality of male sperm. In a study conducted at Lawrence Livermore National Laboratory and the University of California at Berkeley, researchers discovered that genetic defects in the sperm increases with age in men. These genetic sperm defects may cause decreased fertility, increased chance of miscarriage, increased risk of some birth defects, increased risk of stillbirth. The scientists reported that older men not only at risk for infertility, they are also more likely to pass on genetic problems to their child. Take, for example, the risk of Down syndrome. In a study of just over 3,000 children, researchers found that when a woman was age 35 or older, a man's age mattered more. This was especially true if the woman was age 40 or older. In this group, 50% of the children with Down syndrome received that genetic defect on their paternal side. Down syndrome isn't the only risk that increases with paternal age. Older fathers are more likely to have children with achondroplasia, a kind of dwarfism, autism, bipolar disorder, childhood leukemia, schizophrenia. The quantity of sperm cells a male makes varies widely. The average fertile male will produce roughly 525 billion sperm cells over a lifetime and shed at least 1 billion of them per month. A healthy adult male can release between 40 million and 1.2 billion sperm cells in a single ejaculation. Majority of fertile males produce 40 to 60 million sperm cells per milliliter. Fertile males may produce 2 milliliters and 5 milliliters of semen each time they ejaculate. The average single ejaculation may contain 80 to 300 million sperm cells.
Sperm quality examples. Male 1A produced 300 million spermatozoa in 4 milliliters of semen. Male 2B produced 80 million spermatozoa in 2 milliliters of semen. Male 3C produced 22 million spermatozoa in 1 milliliter of semen. All 3 males are found to be perfectly fertile. Total mobility sperm count over 200 million is normal. Total mobility sperm count lower than 5 million is poor. Total mobility sperm count less than 1 million is severely poor.
Normal sperm mortality is at least 20 million per milliliter, and or the ability to move rapidly, 60% to 80% actively moving. Sperm morphology means the sperm's shape and size. 70% to 90% need to normally be shaped. Semen is normally a whitish gray color. Changes in semen color might be temporary and harmless, or a sign of an underlying condition that requires further evaluation. Red semen. Yes, red semen could be a cause for a color change. This could be caused by inflammation of the prostate or the glands that help produce semen. While red semen can be alarming, the cause is usually harmless, especially in younger men. Yellow or green semen could be an infection, such as jaundice or the presence of vitamins or medications in semen. Yes, thick semen usually results from a higher than normal concentration of sperm in a typical volume of semen, or from having a high number of sperm with an irregular shape morphology. High sperm concentration often indicates that you're more likely to impregnate a female partner. A fast and convenient way to begin testing your fertility is to conduct an at-home sperm test, which detects a specific protein found only in sperm. Home sperm tests require ejaculation into a collection cup. While procedures vary for transferring semen and completing the test, results are typically available within a few minutes. The tests work by detecting a protein found in only sperm. If a home sperm test indicates that your sperm concentration is low, negative, you'll likely want to consult a doctor for a complete fertility evaluation. A positive test result indicates that your sperm concentration is considered normal. A normal sperm count doesn't tell you whether you're fertile or not. Home sperm tests only determine sperm concentration. They don't measure any other factors. Many common causes of male infertility are missed by at-home sperm tests. A typical semen analysis performed by an infertility specialist assesses semen volume, total sperm number, sperm concentration, vitality, percent alive, movement, motility, shape, morphology. If you get a low reading, negative reading, and are still unsure about your fertility or infertility, a urologist would be the best place to start. After a physical exam, your doctor will probably order a semen analysis, which will check the quality and quantity of the sperm in your semen. A trained expert checks your sperm count, their shape, movement, and other characteristics. In general, if you have a higher number of normal shaped sperm, it means you have a higher fertility. But there are plenty of exceptions to this. A lot of guys with low sperm counts or abnormal semen are still fertile. I want you to have the healthiest sperm, to have that perfect healthy baby at birth. Don't give up, as I will provide you with all the tips and tricks my girlfriend and I used to get our precious baby girl. No matter how old you are, if you still have your sperm, you will have the opportunity to get her pregnant. By the end of this series, you will have all the knowledge and opportunity to increase your chances of getting her pregnant naturally. Subscribe, like, share, so that others who are facing this pregnancy situation may also share in the power of knowledge.